long-term condition where blood sugar is higher than normal because of the problem with the insulin or the hormonal changes. Okay, so how many types of diabetes are there?
Type 1, type 2.
Type 1.
Type 1, type 2.
Okay.
Type 1, type 2.
And if it is happens during the pregnancy, what we will call?
Gestational diabetes.
Correct. Okay, so for that also we have certain rules. We will see that later. Okay. So firstly, type 1 diabetes. It's an autoimmune disease where the immune system destroys insulin producing cells in the pancreas. Okay, so pancreas is responsible to produce insulin. But when patient is having type 1 diabetes, this is an autoimmune disease. Our whole immune system will destroy the insulin producing cells. So there will be no sufficient insulin for the body. So then we will be having type 1 diabetes. Okay, so the body produces little or no insulin. And the other important thing is type 1 diabetes mellitus is also called as, anyone is aware?
Juvenile.
Correct. Okay, juvenile diabetes. So why they will call juvenile diabetes is type 1 diabetes is mostly diagnosed in children. Okay, so 80% maximum it will be diagnosed in children, but it can occur in any age. So like the possibility is in the children, but it can occur in any age. That any age is like, it is the rare cases. Okay, so since it often diagnoses in children, they call it as juvenile diabetes. And then, young adults, but can also occur at any age. This point you should be aware. Okay, so sometime what coders will do, when the doctor is just documenting patient age, okay, the doctor might document patient age is 6 years, and he is not mentioning the type of diabetes. He is mentioning only patient is having diabetes mellitus. And by seeing the patient age, most of the coder assume that since patient age is 6 years, he will definitely will have the type 1 diabetes mellitus. Okay, that is wrong concept. So you just have to look for the provider final statement. Okay, so if he's not mentioning the type, then we have one particular coding guideline for that. Okay, that we will discuss later. So do not restrict on patient age and decide what kind of diabetes that patient will be having. Okay, so next, type 2 diabetes mellitus. So the most common type of diabetes, so type 2 is most common, and the body become resistant to insulin or does not make enough. So here in type 2, it will become resistant to have the insulin to make use of insulin. And this can be controlled using diet plans, exercise, or oral medication, or sometimes insulin. So next, what is pre-diabetes? So pre-diabetes, as I mentioned, blood sugar level are higher than normal, but not high enough to be called as diabetes. So as we saw the range in the pre-diabetes, the normal range is less than 5.7%, but in pre-diabetic condition, it will be there somewhere between 5.7 to 6.4. Like sometime if patient is having 6.4 means it is almost, in the 1 point less to call it as diabetes. Okay, so in this range, we will be finding it as pre-diabetic condition. So pre-diabetes is a warning sign. Without a lifestyle changes, may people develop type 2 diabetes within a few years. Next, so here you should know, while coding diabetes in pregnancy, we should be aware about these two kind of differences. One is pre-existing diabetes in pregnancy, and the other one is gestational diabetes or induced gestational diabetes. Okay, so pre-existing means before she get pregnant, she already has the diabetes. Okay, after like she suffered with the diabetes for 1 or 2 years, or she are already, her medical record says she was a diabetic patient. After that, she got pregnant. Okay, then we consider it as pre-existing diabetes during pregnancy. Sorry, pre-existing diabetes in pregnancy. Okay, same way hypertension also. If the patient is already has hypertension and diagnosed as hypertension patient, and later if she get pregnant, then that will also be considered as pre-existing hypertension in pregnancy. Okay, so before pregnancy, she should have that condition. This you should clearly check in the document whether she has this condition earlier to pregnancy or during the pregnancy. That is the one thing that we have to check, because we have the two separate coding guidelines here. So next is, as I said, gestational diabetes or induced gestational diabetes. Here, maybe she was all fine up to 3 months. Okay. So after during second trimester of her pregnancy, she diagnosed as a diabetic patient or hypertensive, or anything related to any chronic conditions, maybe in the first trimester, second trimester, or third trimester. So that comes during the pregnancy. Then you have to consider it as gestational diabetes or gestational hypertension. Whatever the chronic condition she will get during the pregnancy, that will be considered as induced condition. Okay, which is during. So here, diabetes that develops only during the pregnancy in women who did not have diabetes before. So outcome usually resolve after birth, but it increases the future risk of type 2 diabetes for both mother and child. So it is quite very normal for the pregnant woman. Like many of them will get the gestational diabetes after delivery or after the baby, after their the postpartum period. That there is a high chance that it likely resolve. Okay, so that comes due to hormonal changes. Next, we have secondary diabetes mellitus. So secondary diabetes mellitus means diabetes caused by another condition or a factor. So due to some underlying condition, that patient will get diabetes. So that time we will diagnose, or we will call it as secondary diabetes. Okay, example you can see in diseases like pancreatic cancer or cystic fibrosis. So here, if they are for pancreatic cancer, assume they are removing the pancreas. Okay, the pancreas they are going to remove, or already the pancreatic cancer means it is a damage to pancreas. So because of that, patient may get diabetes. Okay, there will be no insulin production. So obviously, patient will get diabetes. So here the underlying condition was pancreatic cancer. So for that reason, patient got secondary diabetes mellitus. Okay, same goes here also. Removal of pancreas. Okay, pancreectomy. So for pancreectomy reason, patient may get diabetes. That you have to consider it as secondary diabetes mellitus. And also we have one more thing, like induced drug diabetes. Okay, induced drug diabetes means patient will be taking some long-term medication for other underlying condition. Okay, so since they have taking the long-term drug therapy, it may cause certain side effects. Okay, like adverse effect. That adverse effect led to diabetes. Okay, then again we consider it as secondary diabetes mellitus. Okay, so main thing here, to call it as secondary diabetes, that patient should have suffered with one more underlying cause. Because of that underlying condition, patient is now suffering from diabetes mellitus. Okay, then only you should call it as secondary diabetes mellitus. So next, here I already explained drug-induced diabetes. That means diabetes that develops a side effect of medication or toxin substances. Okay, or toxic substances. So example, long-term steroid therapy, chemotherapy drugs, or exposure to toxic chemicals. So after that, if patient diagnosed as a diabetic patient, Then they will find out the root cause as a drug. So then we will call it as drug-induced diabetes. Okay. So next we have obesity. Okay. So obesity and overweight. Here, obesity is defined as having excess of body fat that affects the health. It is measured using body mass index.